And very specifically, I left for lack of ethics and lack of accountability. And it's disappointing again because it didn't have to be that way. The eventually became clear that no one was going to do anything.
Hello and welcome back to The Perch from the Wyoming Tribune-Eagle. I'm Noah Zahn, your local government reporter here. This week, I'm sharing a story with you that I wrote last week about Cheyenne Regional Medical Center, or CRMC. I spoke with several doctors who have worked there that expressed concerns about employee ethics, administration accountability, and staffing concerns. In December of last year, a group of hospital providers cast a vote of no confidence in the hospital president and CEO, Tim Thornell. Following this, the Board of Trustees conducted an investigation and unanimously voted to have full confidence in Thornell. Since December, several doctors have left the hospital after they said they feel their concerns were never heard or addressed. One of those doctors who I spoke with was Dr. Damon Kennedy, and for the past 9 years he's often been the sole heart surgeon at CRMC. In his time at the hospital, he said that he saw lots of turnover in the catheterization lab, or the cath lab. He said he saw 15 cardiologists come and go throughout that time. Last December, he left the hospital. His concerns first arose around 3.5 years ago when the cath lab was shut down after 3 complications, or deaths, occurred in 1 week. He said the lab reopened 2 days later, which he said he felt was not enough time to have addressed whatever issues caused it to shut down in the first place. Dr. Kennedy said he felt the cardiologists in charge at the time were not being honest with the families and not telling the whole story of how these complications occurred. He presumed part of that was because they did not want to own up to their mistakes, something he considered to be highly unethical. He took these concerns to hospital administration, including CRMC President and CEO Tim Thornell.
Where I took all those concerns about ethical things to them, and there were a lot of comments made about patient safety and patient advocacy and all these, I guess we'll say, nice comments. But then I would argue that zero was ever done about anything to fix it. So my main thing was I left after 9 years of asking, and not just asking, but 9 years of just saying, hey, why are we having so many complications? What's going on here? No one seemed interested in even acknowledging that it was even a concern. And again, I took it to the people that should have been concerned about it.
He told me that he continued to speak up to try to see more accountability and care for the community from the administration, but he eventually lost hope. He left CRMC in December to practice in Arkansas.
And very specifically, I left for lack of ethics and lack of accountability is why I left. And it's disappointing again because it didn't have to be that way, meaning supposedly someone's in charge of that and should have been paying attention and managing it. And after however many meetings, however many discussions and promises made about patient advocacy and all this stuff, the eventually became clear that no one was going to do anything.
2 days after Dr. Kennedy left, a group of CRMC providers gathered to vote on several issues, including a vote of confidence in Thornell. Though the hospital did not provide me numbers whenever I requested it, several providers who attended the meeting told me that they estimated around 65 to 70 providers cast votes, and many more attended the meeting. They told me that around 70% of those who voted cast for no confidence in the CEO of the hospital. Since that vote occurred in December, several other doctors employed at the hospital have left over staffing and administrative concerns, saying they no longer see it as a healthy place to work. After that vote, the CRMC Board of Trustees launched a review of internal quality metrics, staffing and safety data, physician and staff feedback, and engaged in direct conversations with individuals across departments and roles, including clinical, support, and administrative staff. The board also opened multiple confidential channels for employees and medical staff to share their concerns, according to CRMC. However, none of the doctors who I spoke to for this story said that they were interviewed as part of this investigation. When the review concluded, the hospital board unanimously voted to have full confidence in Thornell. Though nobody from the hospital board of trustees was willing to speak to me for this story, its board chairman, Pete Obermueller, sent me responses to several questions in an email through the hospital's media relations department. Obermueller wrote that the decision was based on the totality of information reviewed, not a single vote or moment, but a broader look at performance, stability, and the path forward for the organization. In a separate statement sent to the media the week prior, CRMC commended Thornell for guiding the hospital through the COVID-19 pandemic and raising profit margins to a level that exceeds industry standards. The release read, "This financial stability ensures us to reinvest directly into our community, enhance the quality of care, and support the long-term sustainability of our services. Additionally, our strong patient satisfaction scores reflect the high levels of care and compassion our teams deliver every day. These accomplishments collectively reinforce our confidence that Tim remains the right person to lead this organization moving forward." I spoke with another doctor who recently left CRMC last month, Dr. Steve Burgess. He worked there for 6 years as a hospitalist. And hospitalists generally focus on managing inpatient care, such as diagnosing, treating, and coordinating services during a hospital stay. His primary concern was how the hospital administration handled staffing in the hospitalist group. I spoke with another hospitalist who is planning to leave the hospital in the coming weeks for the same reasons, Dr. Tyler Maxey. Dr. Maxey told me that there were typically 16 or 17 hospitalists on staff, with 6 working each day and 1 working in the evening alongside a nurse practitioner to ensure that the hospital had 24 hours of service a day. Before the hospital switched to 5 hospitalists a day, down from 6, Dr. Maxey said he was typically seeing 14 or 15 patients a day. And according to a 2020 study from Health Services Research, a hospitalist's capacity should be to care for between 10 and 15 patients per day. When the hospital sold the management of the hospitalist group to an outside provider, Aligned Providers Wyoming, they made the switch down to 5 hospitalist staff per day. By the time Dr. Burgess left earlier this year, he told me he was typically seeing around 23 patients per day.
I'm pretty efficient about what I do, but it got to the point where I'm rounding on a patient, seeing the patient for the first time that day at 9:15 in the evening when I started at 7 a.m. And that's just not safe.
At the time, Dr. Burgess and Dr. Maxey said they opposed the sale and were not informed of why it needed to occur. Both speculated that the move was financially motivated. In a media statement on May 15th, CRMC said the change to Aligned Providers Wyoming offers physicians more control over their work schedules, helping to address some of the staffing frustrations voiced by hospitalists. Obermueller told me in a statement that CRMC has maintained full hospitalist coverage throughout recent years and continues to do so. His statement read that, to strengthen consistency in inpatient care and ensure accountability to patient safety standards, CRMC recently transitioned its hospitalist services to Aligned Providers Wyoming. It continued, stating that outsourcing department management is a common and successful practice of hospitals across the country. This model supports reliable, around-the-clock care and was implemented following challenges with current hospitalists meeting shift coverage expectations under previous structure. Dr. Burgess told me this reasoning was never explained to him and other hospitalists at the time.
No explanation as to why the hospitalists were going to be employed by an outside group. No explanation as to the changes in staffing levels. They've just said, well, this is what we're doing. And doing it at a time when the hospital's operating in the black, not in the red, and they say patient satisfaction scores were the highest that they've been in a decade. Well, clearly we're doing a good job, so why mess with us?
Dr. Maxey said that when he asked hospital administration if this change was a patient safety concern, he said that their reply was an emphatic no. When the group of providers met in December and passed a vote of no confidence in Thornell, the providers also supported a resolution to postpone the implementation of changes to the hospitalist service. Dr. Maxey moved to Cheyenne 4 years ago. At the time, he told his wife he never wanted to move again and wanted Cheyenne to be the place where they raised their kids. However, he is now headed to work in South Dakota after his time in CRMC concludes in just a few weeks. Obermueller said in a statement that he respects the individual's decisions to leave the hospital and noted that hospitalists make up only 10% of CRMC's overall provider network. In his statement, he wrote that these departures reflect only a specific subset, not the entirety of physicians and advanced practice providers who continue to care for our community every day. CRMC remains adequately staffed and can deliver high-quality care, just as we have before. However, Dr. Kennedy, the heart surgeon, was never employed in the hospitalist group. And I spoke with another doctor who was not in the hospitalist group who had issues with CRMC administration as well. Dr. Stephen Beer is a neurological surgeon who owns Wyoming Spine and Neurosurgery in Cheyenne. He's lived here for around 25 years and, while not employed by the hospital, has worked closely with the nonprofit hospital as a provider. He told me that medical staff in the hospital have lost confidence in its leadership due to systemic failures. He said CRMC lost respected surgeons and specialists, not because they wanted to leave, but because of ethical concerns, broken promises, unsafe clinical practices, and reckless hiring decisions. Dr. Beer said he sees the root of this problem as a leadership culture that prioritizes financial optics and internal loyalty over clinical safety. In a goal progress report that Dr. Burgess sent me, the nonprofit hospital had a 7.3% profit margin in the first quarter of 2024 and a 7% profit margin in the fourth quarter. Obermueller, the Board of Trustees chairman, has also stated that since Thornell became CEO in 2019, CRMC has gone from a 2 stars out of 5 rating by Centers for Medicare and Medicaid Services up to 4 stars out of 5. Dr. Beer said that he sees this flaunting of the profit margins and the ratings as a distraction from addressing more serious internal concerns.
And so, to boast a 7.3% margin at the same time you're relying on polls that may or may not be accurate, and at the same time ignoring the cries from the physician community, the experienced doctors that have been in the community, and then ignoring the patient complaints that we see in social media, I just wonder what truly motivates the decision to, say, hey, Mr. Thornell, this is okay.
In addition to staffing and managerial concerns from the hospitalists and ethical and accountability concerns from Dr. Kennedy, Dr. Beer said that some clinical services have not seen pay adjustments in nearly a decade, saying that radiologists provide extensive care with little assistance from the hospital.
I think that not looking at this from a selfish perspective, but looking at this from somebody who has 25 years of experience, who's seen, I think 7 different CEOs come and go from that hospital, I think the perspective that I have is invaluable, and I think that it's something that they need to pay attention to.
He said he does not want to assign blame, but help CRMC improve and rebuild trust within its clinical community. Along with the vote of no confidence in Thornell and a call for a halt to changes to the hospital's services, hospital providers also passed 2 other resolutions showing no confidence in the physician's clinical director and calling to increase physician representation on the board of directors. In Obermueller's statement to the Wyoming Tribune-Eagle, he wrote that, while the resolutions passed among the group, it's important to understand that the resolutions were not made available to the doctors beforehand, were not distributed at the meeting itself, and do not reflect the opinions of the many medical staff members that the Board of Trustees spoke with over the last 4 months. With respect to the hospital's resolution, there was no text available. Instead, it was written after the vote took place. He continued in his response, saying that we respect the minority views expressed. However, the board's responsibility is to consider the full scope of feedback, performance data, and operational impact with evaluating leadership. This story was published on May 21st, and the full report can be read in print or on our website online at wyomingnews.com. And now here's Taylor Staples, our arts and entertainment reporter, to bring up a roundup of some of the upcoming events in Cheyenne and Laramie County this week.
Today, May 30th, Deanna Carter, a CMA award winner, is performing at the Lincoln at 8 p.m. Also, comedian Louis C.K. will be giving a stand-up performance at the Cheyenne Civic Center at 7:30 p.m. Then on Saturday, May 31st, a bingo event with cats called Meowingo will be hosted at Cats and Coffee Connections from 1 to 3 p.m. And the gallery at the Metropolitan downtown is hosting a Western Boots and Ancient Roots fundraising event at 5 p.m. On Sunday, June 1st, the Pine Bluffs Lion Club is hosting a High Plains Ride for Sight fundraiser at the Pine Bluffs City Park starting at 8 a.m., and the Yiddish Food Festival takes place in Cheyenne at the Mount Sinai Synagogue from 11 a.m. to 3 p.m. On Monday, June 2nd, an event in the library called Write and Call Your Legislator will take place from 5:30 to 6:30 p.m. Also, right outside the library at Performance Park, Ralph Tomer from Gold's Gym will have a fitness series session from 6 to 7 p.m. On Tuesday, June 3rd, children and families can go hiking starting at the Pine Bluffs Library at 10 a.m., and people can learn how to bake with sourdough at the Laramie County Library from either 1 to 2 p.m. or 6 to 7 p.m., depending on their age group. On Wednesday, June 4th, the library is hosting a chair yoga and poetry event from 11 to 11:40 a.m., and Wiz Khalifa is performing at the Lincoln at 8 p.m. And finally, on Thursday, June 5th, Adults and families can watch a Screen on the Green movie at Civic Commons Park starting at 5 p.m., and music lovers can check out Rachel Cole at the Lincoln at 8 p.m. Her performance is the third concert in their Lincoln Sound Session series.
And before we close out today, here's a quick recap of some of our top stories and headlines from this past week. The Wyoming Republican Party has dismissed its lawsuit against Laramie County Clerk Deborah Lee for conducting what it said was a flawed voting machine test prior to last year's primary election. The lawsuit was filed last year in August by the state GOP after former Laramie County GOP Chairman Taft Love issued a complaint with the Secretary of State's office over a flawed voting machine test. As staffing at the Wyoming Department of Corrections has increased, 30 more Wyoming inmates housed at the Tallahatchie County Correctional Facility in Tallahatchie, Mississippi, have been moved back to the Cowboy State. The Wyoming Department of Corrections sent 240 Wyoming inmates to Tallahatchie in November 2023 because of staff vacancies. Since then, the Wyoming Department of Corrections has anticipated maintaining inmates in Tallahatchie until staffing increases within the agency. The city of Cheyenne is proposing the annexation of 44.65 acres of various tracts of land that contain 95 parcels. The areas proposed to be annexed are county pockets, currently completely surrounded by city boundaries. Several residents who live in that area spoke in strong opposition to the move when the city council held a public hearing on the item Tuesday evening. And finally, Wyoming lawmakers discussed the possibility of drafting a teacher bill of rights Wednesday morning amid rising concerns of behavioral health issues and lack of support for K-12 teachers in the classroom. That's all for this week's episode of The Perch. Thank you for tuning in, and be sure to check back next Friday for more.